Today we are visiting Amphia Hospital and we're going to meet the doctors. They tell us more about conditions they treat.
For patients who have had the autologous stem cell transplantation recently, they cannot go out of the room.
How care can be improved in the future.
It would be really great to have a facility where patients can meet each other to keep them physically and mentally very strong.
And what our crowdfunding efforts will be.
This is the Amphia Hospital and we will take you on a short tour through the ward of the hospital.
Man, we have spent quite a few days here, haven't we, Jan?
Yes, it is. And you can't imagine when you are in the bed, sick like that, how busy it is here actually on the ward. But when you're recovering from your chemotherapy or your operation and you're walking down here on the hall, then you see how busy the nurses are.
Hans has a form of non-Hodgkin lymphoma. He has mantle cell lymphoma, which is a very specific and rather rare type of non-Hodgkin's lymphoma. In the Netherlands, there are about 200 new patients per year with this disease. In the total of US, there are 4,000 new patients per year with the diagnosis mantle cell lymphoma.
Jan has a follicular lymphoma. A follicular lymphoma is an indolent non-Hodgkin lymphoma, which means it's a low-grade lymphoma. It's a lymphoma that grows slowly. And most people do not have symptoms when we diagnose them. And that means that people get a wait-and-see policy. So we monitor him, and in case he gets symptoms, we give him radiotherapy or chemoimmunotherapy. In the Netherlands, there are 700 new diagnoses of follicular lymphoma. And in the United States, there are 15,000 new diagnoses a year of follicular lymphoma.
I must say at the time, both types of cancer are more like chronic diseases that we can get under control with therapy, but will relapse every time. There is the curable option of allogeneic stem cell transplantation, but that kind of treatment is really intense and not suitable for most patients in the end. Having said that, we would really like to have new medications that get the time between relapses longer or even get them into a cure. That needs research. And newer studies in time, we hope, will give new options for at least getting the time between relapses longer or even cure. One of the standard treatments for younger patients with mantle cell lymphoma is stem cell transplantation, but the bone marrow is empty due to the chemotherapy, and it takes time for the new stem cells to become active again. In that period, which can take a couple of weeks, you don't produce any blood. So that means no red blood cells, no platelets, but most importantly, no white blood cells. And that means you are very vulnerable to infections. So to protect them from all the infection problems that are in the outside world, we treat them in isolation. And that means they are admitted to a room, just like the one we are sitting in today, and they cannot go out of the room except for when it's really necessary to perform like an X-ray or something that we cannot do inside the room.
Some patients really need to stay in this room for 2 or 3 weeks. And that is mentally and physically challenging for patients. Some people do not need to stay in the room but can do a round on the ward. And as you can see, the ward is not very challenging. So it would be really great to have a facility where patients can meet each other to keep them physically and mentally very strong.
Just imagine how wonderful it would be to have a gathering place here.
That would be great.
So donate and share our crowdfunding campaign.
Or join us on our road trip and visit us at your local dealer.